Hello. So I'm here to talk a little bit about a coping skill that can help with depression. And there's an old proverb that says a journey of 1,000 miles begins with a single step. And I think that that single step should take place outside. So once upon a time, I did a little bit of a training on the relationship between sleep and mental health. And what I learned was that the biggest and most important part of the sleep wake cycle is the time we choose to get out of bed. So I think a good coping skill, if you're kind of struggling with depression or lower mood, is to pick a single time each day that really works for you, whether that's 8 a.m. or 9 a.m., and really kind of push yourself to get outside and to get up, and then furthermore go outside. Being out in the natural environment and being exposed to natural sunlight can basically hit the retinal cells in the back of the eye, which causes these nerve signals to fire to a part of the brain called the suprachiasmatic nucleus, which basically shuts off melatonin, which, as you may know, is the brain chemical that helps us to fall asleep. So in kind of darker conditions, the brain produces more melatonin, we become sleepy. Whereas when you go outside and you're exposed to natural, fresh sunlight, it shuts off the production of melatonin. The brain starts to wake up. We feel a little more energized, a little more motivated, and it kind of builds that healthy habit. So I think the very first step is picking a time to get up each day and going outside.